Hi everyone, I'm Steve, back here with Dr. Nario. Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check them out online and see all the different treatments they do and all that stuff. So thanks for being here again, Doctor.
Hi, Steve. Thank you for having me. Always a pleasure.
Okay, I want to address again a question from Jennifer. And what Jennifer did was she asked a question and brought up a topic on one of our videos. You can go right here if you have a question or a topic that you'd like us to cover with one of our doctors or personal trainers that we interview, and go put a question in or a topic you want us to cover. And that will also enter you into a drawing to win a $100 gift card every month. And so what the question was about an autoimmune disorder and exercise. So, first, doctor, what is an autoimmune disorder or disease? What can you tell us about that?
Well, Steve, again, we want to thank Jennifer for that question. And it definitely is one thing that I have been seeing here a lot of in the clinic. Well, chronic diseases, again, these are what we call, of course, related to autoimmune conditions, occur due to the loss of control of the self attacking the self. Maybe you against you. Maybe that's a better picture for it. And it's manifesting through the immune reactions of our bodies, such as creating antibodies against our own. So again, that's how we shoot little missiles that are coming back to us, and it destroys our own system. And again, in the advent of biological therapies and antibodies, again against bad antibodies, we these are remedies that actually neutralizes these specific therapies. Um, and the biological therapies are now out there, and pharmaceutical companies are for sure making a tons of money with that. And better outcomes have been recently been noted in the management when they use these new therapies. Recent research highlights actually says that the role of modifiable behaviors, such as physical inactivity, also contributes to the negative effects on the immune system, thus aggravating autoimmune conditions. So this is why autoimmune diseases correlates greatly towards physical activity.
Yeah, there's so many out there, so we can't really be specific on what Jennifer's needs are. We can kind of hit it from a broad spectrum, right? But
Mhm.
um, there's so many different autoimmune disorders, but you're kind of hit really on the ballpark part of it. So, how does physical activity, how can that help? Can that help?
Well, very much. Steve, it's just one thing that if everybody can do it, that's probably one of the keys we can avoid autoimmune conditions. And physical activity is defined as skeletal muscle body movement that results in energy expenditure. And scientific evidences actually have proven and shown the beneficial role of physical activity to prevent autoimmune conditions. How does physical activity does it? It leads to the elevation in cells that regulate the bad cells in the immune system, which is called the T regulatory cells. It lowers the bad antibodies that attacks our own system, and it also produces a shift of the immune system towards the anti-inflammatory side, which is called the lowered Th1 cell production. And physical activity, just to show you the evidence for this, is safe in almost all autoimmune diseases. You need to hear that word that I use there, almost. And incidence of autoimmune conditions are found to be higher in patients less engaged in physical activity, always in the couch doing nothing. General trend would be patients with autoimmune conditions are mostly less physically active compared to the general population. And physical activity, again, not only is helping with autoimmune conditions, but it gives the course a milder presentation. You have better cardiovascular profile and also improve the mobility of patients. It enhances the quality of life and also actually lowers the severity of pain and again promotes more physical activity for these debilitated patients.
So you were talking about full body conditioning, workouts, resistance training. Sounds like what you're talking about. What about if there's pain? I'm assuming that you don't want to just blast through pain in a workout with something, right?
Right. So a good example. Patients that I see, especially for the ones who have rheumatoid arthritis, and the ones who are athletes to begin with, one of the things I tell them is you have to be careful. It doesn't mean that you're exercising and lifting heavy. It's always beneficial because there are autoimmune conditions that destroys the joints. That's why bodybuilding, weightlifting is not advisable for all autoimmune conditions, but other exercises as well, which I will go into in a bit.
Yeah, okay. So that's the advice I give is stay within yourself, don't push it too hard. So, what general recommendations would you give to someone with general, if you're going to generalize, what kind of general recommendations would you give?
Well, again, going back to Jennifer, I think this is what Jennifer is basically looking for. In general, as we use that term, Steve, is exercises such as walking on a treadmill, yoga, Pilates, very low impact or light weight training, low impact circuit training, even swimming. Swimming is one of the best exercises out there because you're just using your own body weight and it's against gravity. And adding in cardio, aerobics would be a fit and should be a fit to the abilities of the patient. A good one that I always hear and see is rowing, stationary bike, and outdoor cycling as well. And even I'm sure you have this in your gym, the step climber, and also the elliptical machines, and even
Hmm.
aerobics and the dance classes that they have. Again, heavy weights. Again, build out the bodybuilding type of exercise. Not much of those due to, of course, the joint destruction that it can actually induce and actually promote faster degeneration of these specific joints. Majority of these patients also who presents with autoimmune conditions are older. Thus, they also have osteoarthritis, meaning the joints are already worn and torn from all the hustle and bustle of real life. And again, going back to intensity, the regimen of 6 to 7 days is something that I would promote for patients because I always tell patients there is such a thing as over exercising when you're doing at least more than 5 days for a normal individual. But for autoimmune conditions, I always say every day as much as you can, but with these light exercises that I just mentioned. And on our end, we're not only focusing on exercise when we manage this in the clinic, we go for root cause medicine, meaning we focus still on detoxification to IVs, oral, acupuncture, recommendations for anti-inflammatory diet, energy medicine such as yoga and meditation. And we always go for lab work because we want to find the true cause of the illness, such as metals, chemicals, hidden infections. And again, okay, we can still use medicines in autoimmune conditions. But the goal here is to taper them off, and we control them via natural remedies such as supplementation and lifestyle changes. So it's not a bad thing when you're on autoimmune medications.
Yeah, so you're talking about multiple joint type movements kind of combined with cardio, like
Yes,
a stair climber or a rowing machine where you're using a lot of muscles, but there's no impact.
right.
So,
Less stress.
and those are things you can do every day. You just got to make sure you're recovering and so on. So I do know
Right.
that you treat all kinds of autoimmune diseases there, all kinds of different ways. If anybody out there with an autoimmune disease, you might want to check out the clinic and see if you, because autoimmune can be so frustrating. It's like it's like trying to again, I'm not the doctor, but it seems to me, I know a lot of people with these issues. It seems like sometimes it's trying to find a needle in a haystack.
Right.
And,
That is exact.
until someone just tells you, oh, you're nuts, it's all in your head. No, it's
Yeah,
not.
true. Well, the thing
So,
here, Steve, you have to remember that autoimmune conditions is just a symptom. It's just a smoke in terms of related to a bigger fire, because that's why you need to look for that cause while your body is fighting against your own body. And as I mentioned a while ago, chemicals, metals, hidden infections, there's so many reasons why it happens. So don't be stuck that it's the final diagnosis for you. There is a reason why it's out there.
yeah. Okay, well, we appreciate your input on this. Is there anything else you would add, or anything else you think it's important to know in general?
That's it. If they have more questions, feel free to post it. And of course, you and I will go through them fast and easy.
Yeah, and yeah, just post the questions here or on the site if you have specific questions, because I know Dr. Nario can probably answer a lot of specific questions. Um, I mean, the blood work is needed, I know, but I know that you have a lot of knowledge in this area and the clinic treats these. So, yeah, if you guys have questions, you want to know more, please put your comments in there so that you can um, find a direction that's going to at least get you some answers. So, that's Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can check him out online. Thanks for being with us, Doctor.
Well, thank you, Steve. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.